this, especially in lieu of what is happening right now in, I think, around Williamsburg, North Carolina. I'm going to show you a little later on the most current satellite map about what's happening. And as you all know, last year we had Harvey occur here in the Houston area, and I want to talk about what we went through and what I personally experienced, as well as some of the things that some of my colleagues did. Now, I have to give Deb Adams and, oh my gosh, I can't remember the name of her student now, who actually put this presentation together for us at the New Orleans conference last year in June, or yeah, this past June, not last year, but this past June. And they did a phenomenal job with it, but the information is still very relevant, and this is an enormous problem, a huge problem. How do we, as healthcare professionals, deal with a natural disaster? The natural thing to do is you want to take care of your family. That's what you want to do. But yet we have this oath and responsibility to care for patients. And it's a tough one. And I'll tell you a little bit more about some of my experiences and some other people's experiences here in Houston, which are just amazing. I mean, even some of the folks that work for our group, their homes were inundated by water, and they were essentially homeless. And the insurance company and FEMA and whatever else, they don't respond nearly as quickly as they may show you on television. It's not until later when you find out all the trouble people are having, and they're displaced. And if they don't have enough money, it's really a problem. It's really a big problem. So let me go through some of these slides. I think they're very interesting. So Hurricane Harvey occurred a year ago, August of 2017. Was a Category 4 hurricane at landfall on the Texas coast, and it landed actually quite a bit south of Houston. Houston did not experience much of a wind event. Mostly what we had here was rain, and we had 4.7 million people in Houston and Harris County directly or indirectly impacted due to flood and receding flood waters. So both as it's coming in and then going back causes quite a bit of damage. Water movement, when water moves, it moves with tremendous power. Here's a picture of some folks being rescued, and you can see there that they are essentially surrounded by water. There is no way out except for this rescue helicopter. Parts of all 22 major freeways in Houston flooded and were impassable. And if you look at this picture right here, that is the same road. Right here, East Freeway, and that is the same road. There's downtown that you can see, and you can see this entire area is completely submerged. It perhaps was not as bad as Katrina, but it was awfully close to it. Katrina was devastating. It was horrific. And some of the stories that came out of New Orleans about them taking turns and shifts at handbagging patients until exhaustion and not being able to do it. I mean, think about the trauma that would occur at some point when you cannot continue to do something like that, and you have to, and the patient is completely dependent. That's a horrible thing to think about. We didn't get like that here, thank God. but it probably wasn't that far off because it was bad. I'd never seen so much water in my life. Over 300,000 vehicles flooded in Harris County. Over 200,000 homes flooded. The Texas Medical Center, if not the largest, one of the largest medical communities on the globe, flooded. Memorial Hermann Hospital, the entire first floor flooded up to the stairwell. It was a big problem. People couldn't leave. People couldn't get in. People that weren't there, if they had a ride-out team, they weren't leaving. You weren't a ride-out. That's the ultimate in ride-out teams. Huge, huge problem. This is the street of an on-call perfusionist. They aren't coming in. $125 billion in damage. The second costliest hurricane in American history. And keep in mind, I'm going to show you an image here in a little bit of what Florence is about to do. And my heart and our hearts should be going out to all of our colleagues in the medical community right now who have to stay behind because they're in healthcare. And it's a moral dilemma. I'm going to talk more about that, and we got to have that discussion. But it is really a big problem. This was considered to be a 1,000-year flood. 4-day rainfall totaled 51.8 inches of water, of rain, recorded in the greater Houston area. A total of 1 trillion gallons of rain fell in a 4-day period. I have never experienced that much rain ever. I mean, it was, I just, every day, I would go to sleep to the sound of torrential rainfall, and I would wake up at various times throughout the night until the morning to torrential rainfall. And it would come and go in waves. You would think, oh my God, it seems like it's lightening up, but it was only a brief respite, and then it was like there was a waterfall coming out of the sky. It was the most unimaginable thing I've ever experienced. Rainfall amounts and spatial coverage never experienced in the U.S. before since they started keeping records. So the most rainfall ever recorded. 50,000 square mile area, Harvey rainfall, 16.6 trillion gallons of water, enough to supply the entire U.S. water need for 280 days. 3/4 of a year of all the water used in the United States fell in 4 days in the greater Houston area. 275 trillion pounds of water. I mean, when you look at those numbers and think about how much water we're talking about, and it fell out of the sky, which was the strangest thing, because it didn't come in as a storm surge. We're talking about rainfall. You know how rain usually falls in drops? There weren't any drops. They were sheets of rain pouring out of the sky. So how much is a trillion gallons of water? Enough to cover Harris County's 1,777 square miles with 33.7 inches of water. And this volume of water could run Niagara Falls for 15 days. So think about, now 4 days is all it was. So think about Niagara Falls, how much water is cascading over that edge, how much water that is, but all in 4 days. So you have to multiply that almost, you have to 3 times that amount that you see at Niagara Falls, because that much water fell in only 4 days. That's the thing that's so incredible about this. It happened over just 4 days. So there are a multitude of natural disasters that we have to deal with. There's earthquakes, there's floods, there's hurricanes, there's tornadoes, there's windstorms, there's volcanic eruptions, and there's wildfires. In California, they're experiencing that. All of these things create major problems for any one individual, but also as a community, healthcare professionals. Because again, our instincts are to take care of our family, but our responsibilities are to both. Certainly we have that responsibility to our family, but we also have this responsibility to the patients. What do we do? It's an ethical dilemma. Some people may feel very strongly, say, you know what, my family comes first. Too bad, so sad. Sorry you didn't make it, not my problem. They're gone. Some people are like, look, let me send you guys away, get you out of here if possible in advance, but I've got to stay behind. But sometimes it happens so quickly, like an earthquake or a tornado, or possibly even a wildfire, volcanic eruption. You don't ever know when that's going to happen. So there are some circumstances where your family can't get away. None of you can. Do you stay with them if they're safe but displaced and go to work? Or do you stay with them and get them completely out of there? How do you manage that? I wish I knew the answer. And I wish somebody would call in and tell me what their thoughts are, because I've certainly got opinions, but I don't know how I would exactly react. If I knew how I reacted in this circumstance, my family was safe. But if I had a different situation, like our previous guest earlier in the show, Nate, and he's got 2 small children at home, is it the responsibility of those people who have the luxury, let's say, of not either having their family in the same location to step up and go to those circumstances so that people with families can take care of them and not have to do it? I don't know the answer to that either. I wish I did, but I don't. I'm curious what other people think about that. Impact of hurricanes and floods on health of the community. Well, injury and death, medication loss, unsafe food and water, respiratory illnesses, all these things happen quite commonly. Skin diseases, of course, rashes, and they can get infected, cause sepsis, have problems. Psychological related stress, could you imagine hammering your way out of your attic barely, or worse, not being able to save someone that you hear on the telephone calling, begging for help, that can't get through the roof, and they drown as the water continues to rise? That really happened. That actually happened, and they were on the phone asking for help, and they couldn't get helped, and they died still on the phone. That's horrible to think about that. Gastrointestinal illnesses, of course, are going to happen because you're going to drink some of that water, contaminated stuff. It's going to get in your mouth, even if you're not intending to drink it. It's going to happen. Finding food can be quite difficult. Look at what's happening in Puerto Rico. That place was decimated, and a lot of those places were isolated. That was a huge, enormous problem. And I'm not faulting anyone. Not at all. This is not a criticism in any way, shape, or form. But a colleague of mine down there, somebody called up and said, you need to come into the hospital and you need to stay here in the hospital. And he said, is the surgeon going to stay in the hospital? Well, no. And he said, well, I'm not staying in the hospital either. You know, and I can't blame him for that, because that's another issue. Is his responsibility is as a perfusionist. He's one of our colleagues. But does he have a responsibility as a healthcare professional? Does the physician, a physician of all things, have a responsibility as well, maybe even a greater one, to have gone and stayed in the hospital? Because those few physicians that get left behind, those few nurses that get left behind, that are there for extended periods of time, how long can they work for without a break? And you don't know when you're going to get back. You think you do. Oh, it's going to happen, it'll end, it'll be over, we'll be on our way, we'll get back, until something like Harvey happens, until something like Katrina happens, or something like Florence is about to happen. These are serious questions, serious concerns. Again, curious what your perceptions of that are. Challenges for the healthcare system. Initiating a response. What if the facility itself becomes damaged? I was up in Northridge, California, when the Northridge quake happened, and the hospital actually was condemned, but there was a patient that actually needed heart surgery, and we did heart surgery and used bottled water because the water in the sink wasn't working, and poured water, bottled water, to wash our hands with. The surgeons used that to scrub with, and that's what they did. Patient and non-patient surge. So you're going to get, not only is your facility damaged, but now you're getting more patients that you normally would get. Staff shortages, because everybody didn't come in, and now they either can't get in or they're not coming in, whatever the circumstance may be. Medical supply shortages, of course, are going to happen. Food and water supply shortages are going to happen, even in the hospital. Now you have people that may be trapped. You have patients. People need to eat and drink water to survive. So here you are in a hospital. You need these things and you can't get them. Security. People walk in there, crazy people. There's a lot of crazy people out there come into the hospital because that sounds like a real easy place to go steal from, or whatever the case may be. They might even just be there trying to save themselves. You know, who knows? They just have nowhere to go. Loss of city facilities vis-a-vis emergency response, police, fire, ambulance, so forth, and loss of communication networks. Look, I mean, there were hospitals. What happened in Katrina with Charity Hospital, where the generators were in the basement, and the basement flooded. So now they have no generator power. They lost everything. The generators weren't on the roof; they were in the basement. So that was it. They had no power. Healthcare professionals and personal preparedness response skills for disasters. Well, there are professional skills and expectations. We all have basic medical skills well beyond that of the normal non-medical person. First aid skills and training. We can deal with a lot of things. Regardless of whether you're a nurse or not a nurse, you can follow directives and do a lot. Working without technology, you have to be adept at doing that because the computers aren't going to be working, so that's going to be down, and you need to be able to deal with that. So millennials, you're probably going to have a big problem with that. There needs to be the development of a team emergency action plan, family emergency plan for your own family, and disaster training. We just simply do not do enough of that at all. Something that needs to be done. And how do we prepare for stress? You know, PTSD after these events is common. So what's the source of the stress? Work. Recognizing signs of stress. Look at any healthcare professional. Burnout. We're all burned out. Healthcare providers who are disaster victims themselves. Managing that stress, and emotional resiliency and disaster response training. So you have to, I think if you prepare, if you're better prepared, then you're going to be able to deal with the stress a lot better, and your ability to maintain your emotional composure during these crisis situations is going to be much better. But the reality is, we really don't do these things. And it's something that I think especially those of us on the coast with these hurricanes, but I think other people as well need to start taking this more seriously and dealing with it, especially when you're, let's say, like we are, a private group in a community hospital servicing multiple hospitals. We can't put a person in every hospital. We don't have enough people to do that. Simply can't do it. It's impossible. You're in the med center of Houston, Texas. Like I said, either the largest or one of the largest healthcare communities in the world. There's no way they could have enough people to manage everything that's going on down there. So there's going to be skeleton crews during these disasters, no matter what. And if we're not prepared for it, if people don't know who's coming in, there's additional stress of finding people that will come in and ride the storm out or deal with the crisis. We don't have a plan. And I think that's what I'm trying to convey here is I think we need to all be thinking about a plan and what is our responsibility. How do we do this? Perfusion education and emergency preparedness of the perfusionists included in the ACPE consensus curriculum for perfusion training at an accredited program. So, interestingly enough, new students are now trained on crisis managing emergencies, disaster preparedness or emergency preparedness, interventions during a disaster, massive transfusion and autotransfusion, emergency ECMO support, transport of patients on VAD or ECMO. So there's a lot of things that may need to happen. For example, you got a patient on ECMO at hospital X and that hospital is falling apart. You're going to have to get some of these patients out of there. How do we have enough helicopters? How do we have enough people to go on the helicopters to manage the ECMO, to get the patient to another facility that isn't affected by the situation, or transporting patients on VADs? These are things we need to be able to think about. Let's say there's a patient on ECMO in another hospital and you're a perfusionist somewhere else and can get to that hospital, and you're the only one that can get to that hospital, but it's not your patient. Now, how are you going to get privileges there? Got to deal with that. Will your insurance cover you? Got to deal with that. Got to figure out if you can get to the hospital, because there may be a perfusionist in there who he can't stay up 24/7 for the next however long. He's going to have to get some sleep at some point in time, and this could turn into a problem of the thing needs to be hand cranked because the power goes out and you're trying to figure out what to do. Well, he certainly can't do that by himself either, he or she, as the case may be. So I think that there's a lot of opportunity here for us to think about what we can do, how we can better prepare for these emergencies. And what I'm going to do now is I'm going to just very quickly, we're just going to take like a 1-minute break. Make sure you got the phone lines open, and I'm going to come back and we're going to try to answer some questions that may be on the YouTube chat, and we're going to see if we can get some calls to come in. But give us just about a very quick 2-minute break, and we're going to come back and continue to discuss this. Okay, and welcome back to the program, everybody. And we've got our phone lines open, and while we're doing that, we're actually monitoring right now. Is it possible to cut to the current radar or the current satellite to what's going on while we wait for a second to see if somebody calls? What's going on with Florence? Oh, here's the phones. Hey, Min, you're on the air.
Hey, hey, how are you guys doing?
Doing good. We're doing great. Thanks for calling.
Absolutely.
Hey,
Thanks
so
for,
so back when Harvey was going on, you were here working, and I know that we all had a lot going on, and you actually had to get to a couple of hospitals because of various emergencies. Even one there was like a gunshot wound that went to one hospital, and then a couple of patients in the cath lab that they needed emergency support for. What was
right.
that like for you?
Well, at first it was a little stressful, honestly, because getting called in and then trying to navigate and figure out a game plan on access roads and where I could get to and how safely and quickly I could get there to help the patient or help whatever they needed me to be there for.
Hmm.
So it was definitely something that I had to kind of plan ahead to figure out a game plan on where I could go, what roads I know that may still be accessible for me. So I actually took the time initially each morning when I had a chance to get out on the road when the weather wasn't too bad to assess the highways and the roads and kind of keeping up with the news and just updates on road closures and yeah, I mean it was scary though because I mean even though in a truck, I mean I could easily get somewhere and be stranded or stuck and
Hmm.
with no access to get back home.
So you had a big truck.
I did. I had a truck. I had a truck.
Yeah, me
I had a
too. And
truck.
that definitely does help. But
Oh, absolutely.
we had one facility that wanted a perfusionist in house. Now we went to hotels and we hung around hotels during the height of the storm that were essentially within swimming distance of the hospitals. If we had to do it that way, because a lot of the roads were closed, we could not get through. But I think we were very lucky because we have people living in so many different areas of the city that are closer to their respective hospitals. But there were some hospitals too, in fact, that were completely impassable. In other words, no one could get in or out of those hospitals.
Right. Yeah. That's definitely something that aided us in that situation when we needed when we needed some support because being that we're uh, being with the emergencies and not knowing what access roads we would be able to get to, that definitely would play a part in making sure that you have uh, personnel and people readily and able to meet the needs because I mean in addition to just patients possibly getting admitted to the ER, our typical day, someone getting admitted to the ER with chest pain, we have patients that have possibly been in house who have come days previously before the storm and gotten admitted and could have been there waiting for surgery and something happens or whatnot, and they go for a cast, and just, I mean, there's so many different scenarios that could bring a patient our way and definitely need us to be there ASAP.
Yeah, well, that's a very good point. But looking at the for example, the one perfusionist. And again, I am by no means criticizing anybody for whatever decisions they made, their own personal decisions, because I just simply don't. I mean, I think that some of these disasters are so horrible, and yes, we have a responsibility, but you've got a family and your family is in peril, and how do you leave them to go over there? I mean, it's a very difficult situation to be in. But I've heard the argument, well, if the surgeon's not there, then why do I need to be there? And unfortunately for us, we can put patients on ECMO without a surgeon. We can't put the cannulas in, But a cardiologist, if there's a cardiologist there, certainly can. An
Right,
emergency room
absolutely.
physician, if they can get access and know how to do it, can do it.
Right,
So, what do you do? How do you
right.
manage that?
That's that's very true. I guess you can't just go on the basis of the surgeon's not going to be there, then we're not going to be there. And I mean, absolutely. I mean, it's kind of like we getting called for a gunshot wound. If the patient gets a thoracic gunshot wound, then obviously that's we'll need a CV surgeon. But of course, a general surgeon or ER doc is going to have to manage and do what he can until that person can get there. So yeah, being that said, that does definitely um, not omit us from having to be there. But you make a good point on yes, we have to worry about the safety of ourselves and our families and
Yeah,
whatnot
absolutely. I
too.
mean,
So
men, where do you draw the line? I mean, look, it's a
right,
good. I mean, where do you draw the line? When do
hmm
you say that I am either going to or I am not going to risk my life to get to that place for that patient? When do you make? How do you make either of those decisions?
I think I think you would just have to use your best judgment on what kind of I guess a plan that you have with your team with in an emergency situation like that because you have to know what people you have in one location and what hospitals you can get to and like you said when do you draw the line. I think as a person, as a perfusionist, and we're obviously we're all committed, and licensed to do what's best for the patient and be there because that's what we committed to as our job title. But at the same time, I think we definitely have to make the best decision and judgment based on if we think we can get there. I mean, obviously, every situation or scenario could be a 50-50 and could go wrong in any disaster because you never know what you may run into. You could run into high waters. You could run into debris on the road, power lines, impeding us from getting to where we need to go or getting back.
Right.
So, yes, that is a very hard question to really answer. And I
Well,
think it's something that we have to just take upon ourselves and make the best judgment, knowing our scenario and our situation, and if we think we can make the trip and be there and do what we can to get there. I think it comes down to the situation, your area, if you know it well enough to know that you have access, and if you for sure you don't have any access, and uh, definitely from the news and data that you've seen that things aren't open, then I mean it's definitely something that I wouldn't want a colleague of mine to risk his life to go do. And I mean it's I wouldn't know what to say or how we would handle it if something happened.
yeah, that's a very good point.
hmm
Let me ask you this, if I can. Would you,
hmm
how do you think that, let's just use our group as an example.
hmm
Do you think we should have a plan and that plan is those folks who don't have small children, those folks that may not have families nearby or smaller children families nearby, that when it comes to our disaster protocol, those people are preferentially or differentially the ones that are on the list to be first to go in? Or should it be that there's a disaster looming, as opposed to a more acute event, something like a big storm coming, and if it's your turn, there's some rotation then it's your responsibility to have your family leave town so that they're safe, and that is not an additional distraction. I mean, which
Right.
one of those two, how do you do it fairly? Should it be the older people who have less energy, who can't, yeah, it's funny, I know, but it's true. Can't, work as hard, get tired. You can hand crank only so many hours, but a younger person can do more, but their life is more sacrificable. I don't know, I'm thinking just crazy, but whatever,
Right.
I'll throw it out there. Or do you say the younger people have that responsibility, the older people have already been there, done that? How do you balance all of that and make it so that it's fair? Because I can tell you right now, not every older person is going to want to stay behind.
Right, right, right. Well, I mean, and of course, you can't say that it's fair to put the young people at risk because that means young people probably have young children at home, and if something happens to them, then their kids, their kids could be fatherless or motherless, if something, God forbid, happened.
Yes,
Um,
good point. I mean, look, it's true. That's a really
yeah,
good point.
it's a double-edged sword, and I think what you mentioned before, the in a way where some programs and institutes have a protocol evacuation or emergency plan. That is a great idea, and I think that's something that most places use, and that's something that we've used. Like when I was a respiratory therapist at Oshers in New Orleans for Katrina, I was in Katrina. Um, we had a plan, A team and a B team, and me not having any kids, and all I had was a girlfriend and a couple of dogs. I was part of the A team. I volunteered to be the A team, and I stayed, and other people who had families and animals and children and whatnot needed to evacuate. They did, and we stayed, and we hunkered, and we kept the house going until the storm passed, and then the relief team was able to come in to get us out, which was about a week later.
Holy
So
mackerel.
yeah,
So you've been through
and
two. You've been through
I've
Katrina
been through.
and Harvey.
I've had my share.
Yeah, you have. There's no question about it. I mean, I think that,
Mhm,
okay, so for
mhm.
us, should we be discussing this now? In other words, that A team and B team you were talking about, was that prior to the storm forming in the Gulf, or was that something that happened as a result of that big storm that was
Oh,
brewing? Because everybody knew
that
this is coming.
that was something that we've already the department already had a protocol in place, and it protects everyone. It keeps fairness because, and obviously being in New Orleans, and in the South, we get hurricanes every year, multiple hurricanes. And we never know which ones are going to be bad, which ones are going to be good, which ones, we might be without power. So, even though if it's not a storm or we have to evacuate, there's still instances where a hurricane may come and we may lose power, and in that case, if you have some people who have families at home, and they need to attend to them, maybe they might be caring for an elderly person, a mother or father who might be disabled, things like that, and they're at home, and God forbid they're on some kind of support, and need power and whatnot, then obviously those people would definitely need to be part of the A team, and it's kind of one of those things that we would volunteer and rotate, and if someone has special needs and they always need to be part of the B team, then we make that happen, and we work as a team, and that's what we do at the end of the day. We have to work together and make it happen, and
And to
see
make it fair.
exactly, and
So
make it
it was
fair.
sort of
Absolutely.
voluntary. Well, Silent Scope 1032 on YouTube says, and I don't know if it's a girl or a boy, I don't know who it is, but each person with the same job title have the same responsibilities, old or young. So that's their take on this. So, and I sent back a question to Silent Scope 1032. How do you manage disasters? So, Silent, if you're in there and you're watching, please don't remain silent, because I'm curious, how do you deal with this? Do you have a plan already in effect? Do you just do it on a rotation? So this week it's Team A. That next week Team B is basically on the hook should something occur. And so I think that's a good question. So here, Silent Scope responded: a manager or a boss should not have an expectation of one employee giving more than another. Well, that's true. Okay, but how? But Silent, how do you manage it? I think that's really the question.
Right.
You know, I don't know. I don't know the answer. I don't know what the right answer is, to be honest with you. But I think that as a group, we separate from, of course, my colleagues out there in web world, I recommend that you additionally sit down as a group and discuss this, because the disaster can befall anyone. It doesn't have to be hurricane risk country like the coast, the southern coast of the United States, Gulf or Atlantic. It doesn't have to be California with wildfires and earthquakes. It doesn't have to be Oklahoma with tornadoes. It can be anywhere. So blizzards, happen. I mean, anything can happen. So you just don't know. And if you're in that situation, what is the plan? You have to have a plan. And right now, I don't think we have one. Fact is, we don't have a plan. And I think we need one, because this hurricane season, look, our memories are horrible. Harvey it was just a year ago. And we're all, here we are, we don't have a plan.
Right. And definitely, we should be proactive. We should have a plan set in. And because you don't want to wait till the time comes and then so-and-so, can't do it and this and that, it should be set. And, once we have it set, then we all know what we're committed to. And when that time's come, then everybody's going to be expected to pull their weight and play their role, their position on whatever team they're listed on. And granted, if there's a specific issue on why a reason they can't do it, then, that's just something that they would have to work out with the team. But I think at the end of the day, it's something that everyone should set into play and create a protocol to protect us, protect our group, protect our name, protect our license, and protect our reputation for what we do and who we are as perfusionists and our responsibilities. And at the end of the day, we also need to look out for ourselves, because no one else will. At the end of the day, we have to take care of each other.
Yeah, I agree with you. I think, I think all of those are very good points. And I think that, Silent Scope, whoever they are, has a very good, has some good thoughts, and that being that a manager should not have an expectation of one employee giving more than another. I mean, I think that's probably true. But, I do think, of course, I view it perhaps a little differently. I feel like the manager should be the person, one of the people that stays behind. I think that's what your role dictates, regardless of what's going on. When Harvey occurred, and I'll give myself a pat on the back. I'll do both sides. I could have bailed and gone to Alexandria, Louisiana, and been high and dry the whole time, but I didn't. I stayed here. I got a hotel by the hospitals, and I was part of the team in the process of what needed to happen. Because I don't believe, in adding to Silent Scope, I don't believe that a manager should expect something from their team that they themselves are not willing to do. That's what I consider to be leadership. That's a leadership issue.
Right.
But that happens, probably not too infrequently. However, with that said, it didn't happen here, and I'm proud of myself for that, and I'm proud of everybody else that's, in our group that stepped up, those of us that did step up and deal with this very, very big problem, because it was a very, very big problem. And it could have been a lot worse. I think we were very lucky in a lot of ways, because it could have been far worse than it actually was. So I think we dodged some bullets as far as that's concerned. But I do think that we do need to have a better plan. I think you bring up some very good points. Regardless of what method we use, I do think we need to come up with a decision soon, within the next couple of weeks, of how are we going to manage a major catastrophic event, whether in both ways, one that is perhaps predictable and one that is not predictable, and figure out how we're going to do that. Because you're right, we don't have a plan, and we need one.
Right.
And everybody else needs a plan too. I think this is not something that's unique to us. I would dare say that I don't think most people do truly have a plan. I think some do, and we need to learn from them, and we need to get one ourselves.
Right. Absolutely. Absolutely.
Well,
at the end of the day, it's going to save us. It's going to save. It's going to help everyone out, and we will know what we need to do and what actions we need to take to be there, and if they need us, and get to where we need to go.
Right, and of course, if you have it already, everybody already knows what the expectations are. You're not scrambling and having to either ask or then demand or direct order people to do something. Yeah, I think when you do it in advance, then look, this is what we've decided on. It's a lot less of a problem.
Mm-hmm. I agree.
Okay, so can you stay with us for a few minutes? I want to show everybody something. I'm going to go over to our weather map, and I want to talk a little bit about what's going on right now in Florence. And again, I started the program off with this, and I'd like to end the program with this as well. A little bit of brevity as well, just have a little bit of fun, but also before that, the seriousness of what is actually happening. We do have a lot of colleagues in the North Carolina area, and they are currently, in an emergency, dangerous, and treacherous situation where they're getting pounded by a very powerful storm. And I think that we all need to say our prayers for them and hope that they do well through all of this, and that the damage is minimal, and loss of life is non-existent, I hope, and that our healthcare professional colleagues are able to manage all of the problems that may occur, that they don't have that many problems to deal with, but those that they do deal with, they're able to